Hey everybody, it is Thursday, June 20th, 2024, and I thought that I would do another update on a YouTube video to sort of explain what has happened over the last week and kind of where we're going to go from here, so what happened was, obviously I was scheduled for my surgery tomorrow, June 21st, and we had had it on the calendar for a long time, for a while. And so part of that was the pre-op testing, which I thought was going to be routine. And I had scheduled that for last week, so we had EKG and blood work, and then we had a chest x-ray, and I didn't think anything of it. And really, I sort of went into it maybe a little bit more flippantly than I should have, but I really just thought we're just smooth sailing, we're on schedule. So apparently, what happened was the chest x-ray came back with I don't even know how to say, inconclusive spot on my left rib posterior. And when you have a diagnosis of breast cancer, immediately they are going to put on your report that it is, metastasis cannot be excluded. Well, of course, nobody wants to see those words. So what happens is that automatically triggers more tests. And, well, panic in my heart, because I've been on this sort of mode of a certain thing, and without even worrying that this cancer might have metastasized, because that's not at all any of the indication that my surgical oncologist has given me, my medical oncologist, all the tests, everything. My original diagnosis, the lymph nodes, nothing has actually even ever pointed to that direction. So this was kind of a shock. So anyway, okay, so they order my surgical oncologist so the pre-op testing happened last week. So we're in kind of a rush to get all of this stuff done by the time for my surgery. So my surgical oncologist has all of the bigger picture. So we really quickly, we get a CT scan scheduled, and that happened last Friday, and to view what that thing was on my rib. So apparently it came back as a benign fibrous, I forgot the name, but it's common. It's probably something I've had forever. I really honestly do not remember ever having a chest x-ray, and if I did, it was when I was a kid. I don't know. So apparently it's there, and it's benign, not a problem. But then the damn thing showed up that there were hepatic lesions because they have a field of these things, so they can see some of that. So okay. So it's been this, I called it a rabbit hole, one after another. So then all of a sudden, now I have to have an MRI, an abdominal MRI. And now I have to have a bone scan, because then there's something else that perhaps the CT scan, so it's been this horrible chain of events that really has compounded with each other. And again, each time it says, because of the cancer diagnosis, metastasis cannot be ruled out. So then it automatically orders more tests. So then I go all weekend not knowing, of course, what the results were for this, the CT scan, and I had to wait till Monday to get the results. But then which is completely, it's just, they call it scanxiety. They don't call it scanxiety for nothing, because it's just a horrible feeling. I don't want anybody to ever have to go through this. It's just awful. So then I get the results, but then my oncologist wants me to have a bone scan and an abdominal MRI to look at my lesions in my liver, hepatic liver. So, all right, so we get that going. So that happened. So today is Thursday. That happened Tuesday. So, all right, I go get the abdominal MRI. It was not too painful. It was fine. It worked out. And then I get the bone scan. And so then I get the results from the abdominal MRI, and they're blood vessels in my liver. Fine. Well, the Taxotere, the last chemo I had, has really wrecked with my you can see I'm flushing, I'm red, my blood vessels. It has that effect. I still, 5 weeks after, I still have a lot of side effects from that. It will take time to go away. So then, let's see. So then, okay, I got those results, but the bone scan was inconclusive. And on top of that, it showed some other areas of maybe inflammation, maybe this, maybe probably degenerative issue, because on the CT scan, it showed that there was an area on the T12 vertebra that they needed to look at. And that was the CT scan that I did last week. So that was kind of an incidental finding, is what they call those things. So then that's what triggered the bone scan. So now I have the bone scan on Tuesday. So now the bone scan comes back, and I tell you what, that's clear as mud. I mean, there's more questions that came up than answers on that bone scan, and I don't know how anybody could read that. I don't know how you can read it. It's some of those images are very blurry and and one of the things I found out was that when you undergo chemo, you're not supposed to have these scans until at least 8 to 12 weeks after you're done with your chemo, because chemo can cause these inflammatory markers in your body, which apparently I do have. So I know I have a knee issue. I have an issue in my neck from all those years of being a hairdresser. So all that shit shows up. So all of it shows up, and all of it now is like suspicious, because again, the diagnosis of breast cancer. So now we're really at this is, I get those results with Tuesday, and I'm talking to my doctor yesterday, and I'm trying to figure out what the hell it's going to do. Are we going to have our surgery or not? Well, the bottom line is that he has ordered a PET scan, and which is apparently the definitive. And apparently he says, I talked to my surgeon yesterday, and he says he could not order that first because it would have gotten denied, and because based on my diagnosis, originally, I was not qualified for a PET scan because there was no evidence that the cancer had metastasized. But now all of a sudden, he wants to be sure, and I have to respect that. But at the same time, I'm like, can we look at the bigger picture? Can we look at the more holistic picture instead of what the radiologist is telling you? And look at me as a person, and look at me as the fact that I went through this horrible chemo, the Taxotere, and I'm only 5 weeks out, and I'm still having inflammatory process in my body. So can we maybe consider that when the PET scan comes back, and not make assumptions based on my care just because the radiologist says it's this, that? So the bottom line is that because of all this uncertainty and questions, he canceled my surgery, and I was really very upset yesterday. Still am, but there's not much I can do about it except for advocate for my own self and try to push, and so try to get more answers. My PET scan is not scheduled. They cannot get me until July 5th, which I was very unhappy about. I told him, I said, my husband is not happy with this. He agreed. They're really trying to push to get me in earlier, sooner. But I've also suggested, I've sent messages to him and Dr. Bureau, my oncologist, and said, hey, can we look at the bigger picture and maybe consider the fact that I have been going through this chemo, and I do have these inflammatory issues in my body, and maybe it's not metastasis, and let's maybe take a step back and look at the bigger picture. Maybe can we think about, y'all have you and Dr. Barham or whatever have a powwow, and let's agree to do the surgery, get it done, put me on hormone blockers, and then when my body has calmed down, let's redo the PET scan, so that we can actually get, in my opinion, a more realistic view of what's going on in my body. And then we can address it from there. And then if somehow the cancer has jumped ship and ended up in my bones, well, then it's not a death sentence. It just changes the treatment plan, and it changes how we look at things. I don't think that's going to happen, but you don't know. I don't know. But what I don't want to happen is, what I'm worried about is that my diagnosis or decisions are being made by a radiologist who reads the report, that doesn't know my history, that doesn't know my background, that doesn't know what I've been through, and just says A, X, Y, Z. So I think that's my biggest fear, and that's what I'm going to really be fighting. That's what I'm fighting for right now, is to be sure that they see me as a whole person, as a holistic person, rather than just a report, and then make decisions based on that report. And I'm sure that this is not the first time that somebody has shared or felt this way. You really have to advocate for yourself. So that's kind of where we're at now. I don't have any other answers. Right now, I'm starting a sourdough starter, which is a lot of fun. And I have a lot of that, I don't know, what do they call it? They call it the leftovers or spoils or whatever. So I'm going to make some cinnamon rolls today. And, I have nothing on my schedule, obviously, because I had cleared everything for surgery. And so fine, I'm going to make cinnamon rolls. And then I'm going to go play with my camera, my new lens, maybe later today or tomorrow. I don't know. But and then just sort of focus on trying to calm down a bit. And everyone's like, trust. Well, it's so easy to say that, but when you're in my shoes, in my situation, and anybody that's ever been in this situation really can completely relate and understand, it's not easy. And I may present a strong front, but I don't know. I have no choice but to not fall apart. I'm not going to fall apart. And if anything, what I do is I dig in and I dive deeper. And I'm a little bit like a pit bull, So I'm not going to roll over. I'm not going to just accept because that's what they say. That's what the doctors say. I'm going to do some research, and I don't care. I'm going to look up it on Google. I mean, I'm not ashamed to say that I'm going to do that, but I'm going to look at good sources, not crap sources. And I'm not going to continually obsess about it. I'm going to go make cinnamon rolls. But I want to learn, and I want to know, and I want to, so that this way I'm informed, I'm an informed patient, and I know when I speak to my, I've got an order coming from Walmart. An item is unavailable. Oh, well, I don't care. It's fine. I don't care. So, yeah, that's kind of where we're at. And there's really not much more to it. I'm just, like I said, just going to try to keep my wits about me and keep my phone with me, because I know that my doctor's office is really trying to work hard to get that PET scan sooner, that would be good. And at least we get that out of the way. And otherwise, I just thought I would just come on here and at least explain a bit about what happened and what led up to this decision. So anyway, you guys, thanks for sticking by me. And as always, I appreciate it. And when I have more, I will definitely let you know. Okay. See ya. Bye.